Hi everyone, my name is Felix. I'm a nurse practitioner student. With me are Xiaoyi and Jin Feng, and they're programmers from the Department of Computer Engineering. We've created an application that will help support cancer patients undergoing chemotherapy. Specifically, it will help them track how they're feeling and what to do when distressing symptoms occurs. A bit of background information. Chemotherapy uses drugs to kill cancer cells. Side effects are very common. And because chemotherapy is a strong drug that acts on many different areas of your body, you can have a wide range of symptoms that are often upsetting for the patient. Fortunately, these symptoms are predictable. However, if these symptoms are not managed early, patients often go to the emergency department for symptom relief. And in fact, there's data suggesting that over 60% of the emergency department visits in Ontario are related to this issue. More than half of those patients didn't need to be in the emergency department if these side effects were managed early as part of the routine care. To decrease emergency department visits and to improve patients' day-to-day life, researchers have come up with a few approaches to this problem. For the purpose of our application, we specifically use 2 out of the 3 areas identified, as you can see on the slides. For proactive monitoring, instead of waiting for symptoms to happen, it's better to continuously monitor these symptoms. In this way, you can address these symptoms before they become severe. Empowering patients. By involving patients with monitoring their own care and giving them the knowledge to manage their symptoms, we can teach them to take better control of the disease. These 2 solution approaches really inspire our team to develop an application that will help support cancer patients undergoing chemotherapy. It'll help them track how they're feeling and what to do when distressing symptoms occurs. I just want to quickly talk about how our application works. Our application will look at the most common symptoms for a target audience, for example, pain, nausea, and depression, and it will ask specific questions for each of these symptoms, as you can see in the left image here. And after answering all the questions for each of the symptoms, patients will be given assessment results, as you can see on the right image, which will tell them how to address their current symptoms. The application will also give patients a graphical trend of the symptom severity over time, as you can see on the left-hand side, so that they can see if what they're doing is helping. The application will also provide a transcript summary so that patients can review previous answers like a diary, as shown on the right-hand side. And we just want to quickly show you how our application works. For the demo, I want you to meet John. He's a 49-year-old male with colon cancer metastasized to his liver. His treatment is going to be surgery and 6 months of chemotherapy.
Hello, everyone. I'm John. The doctor just told me to use Saam application at home every day to track my symptoms. Now I'm in the profile page. Here's my name, John. Let's get started. Here are some questions about all the symptoms. I think this is about pain where I do have a lot of concern about it because I learned for the side effects. In the very beginning, you might have mild pain, but time goes by, you get worse and worse. So that's the importance to monitor it from the very beginning. Now my pain is very small. I think I can choose just 1.
The pain score is set subjectively from 0 to 10, where 0 is no pain and 10 is the most intense pain. The description below tells John what this number means as a reference.
Let's submit. More questions about pain. Yes, I'm really concerned. Rating of pain, sometimes I got no pain. How worried? A little bit, I think. The pain onset, no. Medicine, I'm using Advil. And I know this medicine will give you a lot of side effects, and that's why I'm using this application. Self-care strategy. Oh yeah, I want to know how I can ease my pain and manage my life. My goal of pain relief. Of course, I want no pain, so let's set 0. I don't have a family member to help me, so that's why I need Sam. They can monitor my symptoms every day. I think that's very helpful. I don't understand the plan. And yeah, I have a lot of concern for the medicine. Oh, that's about pain. Now we get about how tired. I don't have apathy, so we can just focus next. Nausea, oh no. Apathy, yes. I don't have, my stomach is very good, I think. The shortness of breath, I don't get it. I don't get these symptoms. I think I only get pain, so we can just skip it. So I can see this is all my answers. I think it is good. Let's just submit. Oh yes, we got some feedback here.
So you can see the recommendation at the top focuses on when to get help from your healthcare team. And then the self-care management tips at the bottom focuses on the practical tips that patients can do to manage the symptoms at home.
Oh yeah, I think the self-management tips are very useful. I think it just give me some tips for my pain and for my situation. So this algorithm is very important to me, I think so. Let's back to the profile and see what do we have. Let's check our report. Oh, I think I can get all the answers and the feedback here. There's a button, let's check what's the use of it. The Saam report, the patient information is shown here. Yeah, good. There is even a printer function. Oh, that's good. That's good function. I can print it and even bring that to my doctor when I feel it is needed. And there is a trend report. Let's check it. So there are 7 charts, I think. It just tell me whether my, for example, the pain, it tells whether my pain is getting better or getting worse. I think that's the point of this application because you need to monitor it from the very beginning. Even if the pain is small now, but it can get worse in a few days. So just keep track of it. Oh, this is a useful application, I think. And that is almost the demo. So let's Shai to introduce us more about the structure.
Hello. So, yep. Here's the structure of the Saam system. We have 5 main components on the front end for user interactions and the data outputting. The back end of the application on the cell phone has 3 main components, including a questionnaire algorithm for arranging questions, a recommendation algorithm for questionnaire result, and a data query mechanism for communication with the remote database. We use the Firebase platform as a remote server for authentication and data storage. If we have more time for the app, we can complete our questionnaire dataset, complete the whole questionnaire dataset. Currently, we just put half of the original paper form questionnaire into the database since we have so many different questions. We can also develop an application for healthcare providers so that they can help managing patient symptoms as administrators. A website interface can be developed so that content developers can edit the questionnaire through the interface instead of editing the database directly. We learned many things from this project. We found that we should ask our potential users for suggestions before actions. We also found some features were hard to be implemented but not necessary for users. Of course, we need to focus on key features instead of all the features when we need to show our application. We need to be more careful when we're using source control tools such as Git to avoid some bad accidents. Here is the final presentation of the Saam system. Thanks for listening.
All right, thank you. Very interesting. Good work on making this more hang together. That's a significant improvement. I have a few questions. Maybe just 2 key ones. On the last thing you just said, the key learnings were to get user suggestions. Remind me, did you get user suggestions for this?
Yes, I can show you some user suggestions. For example, we have this. I can share my screen now.
Sure. Yes, you can.
But who did you ask?
Sorry, can I share my screen?
Yeah.
I asked to share my screen, but it seems I'm unable to do that. Sorry. Okay, I can just talk about it. We have talked about the skip function. It means some in the very beginning we think, for example, if the user answers the same question for the same answer like 0 for 10 times, then we will not ask it anymore. And for example, maybe after 10 times or 20 times, it will appear again. But most of the time, the user thinks that's not necessary, but it takes us a lot of time to implement it. So I don't demo it today, but we do got this function.
I see. So which users did you ask?
I asked my roommate and my girlfriend.
Oh, I see. So I was just it sort of implied you talk to cancer patients. It's not required, but I thought you. So,
Yeah, it's hard to reach cancer patients.
yeah, yeah. No, that's fine. I was just curious who you were asking, but thank you for that example. Felix, can you talk a little bit about the algorithm for the suggestions? So it seems clear that all this information is coming in, and you're one of the most important things is whether you should, go to the hospital or do the home treatment. How,
Right.
what does that algorithm look like?
It's quite complex, but it pretty much depends on if there's any red flags coming out of the answers, and they try to make it so that it's a standardized approach, and they use this algorithm originally for over a telephone triaging telephone system. So it'll be like a yes or no question, or kind of like similar than the questions that we asked. And if they said yes to it, then it's more like they will be more safe than sorry. So they will refer them to the hospital if any
Sure.
of the.
So what I'm asking, did this algorithm get implemented in this software? Because
It did. So it's that's how our recommendations is based off of.
so in your final report, can you spend at least some time describing that? Because it's sort of it's a bit invisible here, and I think it's important. It comes from your expertise, which is really the core work of this course, right? That your expertise, which is may be a fairly well specified algorithm, given that a telehealth person had it or something, then but translating that into software, you should spend some time talking about it. I think it's a important contribution. Very good. Dan, comments?
I do not have any comments, guys. Good work, though. I think this could be very useful.
Actually, I was curious, Felix, remind me, how close is this to being actually usable?
So right now, I was talking to a few of the researchers at Princess Margaret Hospital, and they were actively trying to implement something similar to a very specific subset of cancer patients, let's say for lung cancer and specifically under a certain type of treatment. They have done it in the past, but I think they really can't get the structure, like the privacy and all the healthcare correctly. So I think they have a huge problem. So they're not there yet.
Yeah,
But I think it's a concept-wise, it's definitely doable.
Yeah, the privacy, I guess you have to live up to that. There are places now that are good at that, but you might have to re-implement the whole thing, I would bet. Firebase probably doesn't do it. Cool.
Yeah, and it seems like everyone is trying to do it at the same time. Like they're getting a lot of researchers from Europe, and they're doing something very similar.
Interesting. Kia, any comments?
Nope. Well done, guys. Good job.